Have you heard of the death grip when it comes to masturbation? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk all about death grip, what it is, does it affect masturbation, and what you can do if you're suffering from it. So what exactly is death grip? Is essentially using a very firm and aggressive grip during the time of masturbation. Now, this is thought to lead to some sort of desensitization of the penis, where essentially things that used to be pleasurable, like for example, intercourse or penile vaginal intercourse, no longer feel good enough or strong enough to make you climax. Now, why does this happen? When you are exposing your body to the same thing over and over again, the same exact way, particularly something like death grip, it can lead to habituation. Now, your hand can create a lot more force and pressure than potentially a vagina can, depending on how firm you are gripping it. And so when you go to have penile vaginal intercourse, you may not experience the same stimulation in terms of firmness, pressure that you would get with your hand, making it more difficult for you to climax because your body has now habituated to that sensation of death grip. And this has a term, it's called idiosyncratic masturbation. Now, it's not as simple as just having death grip. It can be a variety of different things that all contribute to getting this sort of habituation. It can be how often, with what frequency you masturbate. It can be what technique you use to masturbate. Is it the same thing every time? How long you masturbate? What's the duration of masturbation? And lastly, what is the intensity or the pressure on the penis itself? If you are constantly masturbating the same way every time with a very firm grip and you are being exclusive, meaning you're not doing any other types of masturbation, you will get habituated to this and may have issues achieving climax with a female partner. Now, you can imagine there's not a ton of scientific literature on the death grip, right? People are not studying this. But very recently, there was a study done in Turkey in 2023 where they took men who came into a urology clinic for erectile dysfunction, meaning they were not able to get an erection that was firm enough for penetration. And they compared these men to control men who came in for other things like kidney stones or bladder stones or whatever. And they looked at these men and they asked them what styles they used to masturbate. Did they have any abnormal masturbatory behaviors like death grip? And they wanted to see if it was different in men with erectile dysfunction. Are you more likely to have issues with erections when you are involved in these sorts of behaviors? Now, in order to qualify for the study, they not only had to have vaginal penetrative sex, but they also had to masturbate at least once in the last 6 months. So they then divided these men up and they looked at all their other comorbidities. Were there other things that could cause erectile dysfunction or problems with erections, including things like spinal cord injury, diabetes, high blood pressure, high cholesterol, taking medications that might cause sexual dysfunction, and all those people were excluded from the study. So these were people who, if all things were equal, shouldn't have any issues with erections because they don't have any other risk factors. So what exactly were these abnormal behaviors? So one was obviously using things like the death grip, using very firm pressure on the penis or squeezing it from above. Another would be rubbing through clothes or other soft items like toys or pillows. And lastly, it would be masturbating prone or facing down on your stomach. And so when they looked at these men, they found the average age in both groups was about 30, and they had pretty similar baseline characteristics. This included things like smoking, nutrition, and lifestyle. And they used different sorts of questionnaires to sort this out, but generally speaking, there was an equal number of smokers and drinkers and all those things in both groups. They then asked these guys how they masturbated. Did they masturbate? How often? Were they doing it with lubricant? Were they doing it to fantasy or with pornography? And what they found was that men who didn't have erectile dysfunction were more likely to use lubricant. Now hold on to that thought because I'm going to explain why that makes sense after I tell you the rest of the results. If you had erectile dysfunction, you were 2.2 times more likely to have an atypical masturbatory behavior than a person who didn't have erectile dysfunction. Now, this is not causation, right? I can't tell you that doing these behaviors is causing erectile dysfunction, but we are seeing that people who have erectile dysfunction in this very small study were more likely to engage in these activities. The next thing they asked these guys was how hard was their penis? penis using the erectile hardness score. 0 is it doesn't enlarge, it's not hard. 1 is that it enlarges, but it's not hard. 2 is that it's a little bit harder, but still not suitable for penetration. 3 is that it's harder and able to penetrate, but not completely firm. And 4 is completely hard and rigid. They then asked them what their erectile hardness score was during foreplay, during masturbation, and during sex. So then looked at the men who had some atypical masturbatory behaviors and erectile dysfunction and compared them to men who just had erectile dysfunction. And what they found in these men who had TMS, or traumatic masturbatory syndrome is how they defined it, they were more likely to have firmer erectile hardness scores or scores greater than 3 during masturbation, but not during partnered sex. Whereas those who had erectile dysfunction and didn't have those behaviors had no difference between masturbation and during sex itself. So if you're noticing a difference between how firm your erections get during masturbation versus during partnered sex, you may want to revisit how you're masturbating. Are you doing it the same way every time? Are you using the same firm pressure? And maybe using lubricant might be a little protective because it keeps things slippery and you can't actually get a very firm grip when you use lubricant. So the big problem with this is really that when you're in a relationship, it can be devastating because you're now having difficulty getting erections with someone who presumably you really like, you want to have sex with, you want to pleasure them, and you want to be pleasured. And you can't get it. And then you're embarrassed to talk to your partner about masturbation. And this leads to frustration because if you are able to penetrate, you can't climax and you're having difficulty getting there. And so it leads to lots of frustration. And many people who deal with this don't come see a urologist because they're embarrassed. And so what can you do? First of all, if you have any other mood disorders like depression or OCD, you want to address those first because they can really contribute to you self-soothing using these masturbatory habits. Similarly, you want to make sure that you don't have a true urologic issue or neurologic issue. Now, I've talked about how genital numbness can occur, particularly as men age, but a number of different causes of genital numbness on my video about this. So check that one out if you're interested. But ultimately, you want to get evaluated to make sure there's nothing else that's going on that can be corrected medically. And then you want to think about why you are masturbating. Some people use it because it helps them sleep, so that it becomes very clutch, like a sleep aid. Some people do it when they're bored, right? And they really try to use it as a dopamine rush to fill in that bored void. So you want to address why you're doing it and can you alternate something healthier in place of it. So if you're bored, maybe you can find something else to distract you from your boredom that's not masturbation. Maybe it can be going to the gym or seeing a friend or taking a walk. If you are using it to help self-soothe, maybe you can try meditation before bed or take a look at your sleep hygiene and what you're doing before bedtime. So bottom line, do a self-assessment, figure out why you're masturbating and see if there's something you can do to replace that habit, right? And once you've done that assessment, you've seen your urologist, you've been assessed for any other medical condition, then you can start thinking about ways to change this sort of idiosyncratic habit and change the habituation your body has undergone. Now, the first thing you have to do is stop masturbating. Now, how long you have to do that for really depends on you. How long have you been masturbating the same way? How often do you do it? And how long can you really go without it, right? And are you with a partner or not? You don't absolutely have to not have sex. You can have sex, but certainly sometimes abstaining from intercourse may also be helpful during this time. And then when you resume masturbating, the first thing you want to do is start using very gentle touching. Don't even start masturbating like you typically used to. Just take something like a feather or the lightest touch and just stimulate the area. Once you get sort of used to that, then you can go on to doing some type of masturbation, but it's going to be different. You're going to use lubricant. You may use your non-dominant hand. You want to be seated or lying on your back and try to do it that way rather than reverting back to the ways that you were doing previously. And try to explore all of your genitals. Don't just focus on the penile shaft or the head, explore all of it. Consider maybe exploring the scrotal area and the perineum if you're interested. But generally speaking, don't just focus on one part of the genitals. And when you're doing all of these activities, you want to be as mindful as possible. You want to be focused on the sensations you're having, not, oh my God, am I going to climax? Is this going to work? Am I doomed for life? Like, you need to not have those ruminating thoughts, but really focus on how it feels, how your body's enjoying the pleasure, and be completely mindful. And then over time, you will get to a point where you can masturbate again regularly, but you don't want to, again, revert back to those atypical behaviors that may have caused difficulties in the first place. Now, I will say that there are many people who do masturbate in certain other ways and they don't have a problem, right? They still can climax with a partner, they still have a great sex life. So before I end this video, I just want to make sure that everyone understands this is not to shame masturbation. I don't think there is a problem with masturbation, as you probably already well know because you follow me. I think if you are masturbating to enjoy orgasms and feel pleasure, that is totally fine. It only becomes a problem if it's affecting your sex life or affecting your day-to-day life. And that means that you're masturbating over doing other things, or you're preferring masturbation to be with your partner. If you've enjoyed this content, please make sure to subscribe and share this channel with your friends. If you're looking for a urologist, I'm in the Newport Beach area, and we are soon to be expanding to Beverly Hills, California as well. So be on the lookout on my website, RinaMalikMD.com, to book an appointment there. And as always, remember to take care of yourself because you're worth it.